Well, healthcare has really changed, you know, including they got this new standard in Omaha with a fresh approach.
Yes. Think of it as a care community where you're not just a patient with symptoms, you're seen, you're heard, you're understood.
Dr. Brad Copple is a podiatrist with Think Whole Person Healthcare. Good to see you, Doctor.
Welcome back.
Yeah, thanks for
good to
having
see
me
you
again.
So you're a podiatrist.
Yes.
Right? What
I'm
is a podiatrist?
Podiatrist is a specialist of the foot and ankle. We're the physicians that treat this stuff on a daily basis. This is our area of expertise, and this is what we do.
The ankle and below, essentially, right?
Yep, yep.
So we said, where do you work? Because this idea is so different. Tell us about Think.
Think is very different. Think is a new entity in Omaha that is a primary care center. Think of it like a wheel, if you will. At the center of that wheel is a primary care physician. And the spokes coming off the wheel are the team members that are involved in your care. And we have a wide variety of healthcare professionals involved. And podiatrists, obviously. We have dentistry, optometry, physical therapy, psychiatry, palliative care. Patients have their own individual pharmacists that work with the primary care doctors and work with you on a daily basis to help enhance your healthcare experience while also lowering the cost of your healthcare.
So rather than bouncing around from different specialists here to another part of town, it's all together, and you guys all kind of coordinate together. And but for you specifically, what kind of issues do you treat?
I treat anything involving the foot and the ankle, anything from deformities, bunion, hammer toes, trauma. My subspecialty, if you will, is diabetic wound care and diabetic limb salvage.
We have a few pictures to show, and we want to give you a heads up here. A few of these may not be pleasant to look at, but they are important to see in the context of this conversation. So if you got a weak stomach at all, we just wanted to give you that
you're eating breakfast,
courtesy.
right?
Yeah. But
Yeah.
Dr. Copple, would you take us through these and explain to us what we're seeing?
So this is a fairly classic diabetic foot ulcer that happens on the bottom of the foot, and you can see around the ulcer there's that thickened looking skin, and that's how these start. These all start with a callus, okay? So that area of the foot is absorbing more pressure and friction than the skin can handle. Unfortunately, a lot of the diabetics don't have good feeling in their feet, so they'll literally wear a hole in their foot.
So they're not in pain here.
No.
They
no.
don't. Wow.
Look at this
sort
picture.
of-
Now this,
Yeah, that's another one
That's-
that's fairly typical again.
that's common. That's not extreme.
Nope, that's fairly tame, really. And again, that they don't feel anything, so that's sort of the blessing and the curse of it.
So then what do you do when you see these type of wounds? How do you treat something like this? Is it a surgical procedure?
Well, it depends. Ultimately, you need to get a covering for that wound, and there's different ways to accomplish that. In the past, we've utilized skin grafts a lot, but that's really not terrific for the bottom of the feet. So what we have started using is skin that's manufactured in a lab. So I brought a sample of a product here. This is called Graft, and this is from a newborn foreskin. Okay, so they grow this in a lab.
I'm going to tilt it this way so our viewers can see it too.
Yeah, go ahead and you can touch this, and this is living tissue.
And I'm not going to damage it?
Nope, this is for.
And so you take
morning
that
blend.
tissue, right? No, you take that tissue. Then what do? You somehow attach it to the bottom
Yeah,
of the foot?
you just, it's like doing a fancy dressing change. You just apply it to the bottom of the foot,
Wow.
and this incorporates into the wound and helps them grow their own tissue.
And the difference for patients is what, Dr. Copple?
Well, you don't have to go through a procedure to have the skin removed from your leg or your back or wherever, sort of robbing Peter to pay Paul and creating a new wound. You can take this, put it on the wound, have them grow their own tissue, and heal them at a quicker rate. I have a great story of a wonderful patient named Jen who had she had a wound on her foot over a year. So every day she's changing that dressing, and we got her healed up about 8 weeks using this.
Wow.
And that
8 weeks
changes your life when you're in a routine of having to maintain
Yeah,
it.
it takes a lot of work to stay on top of those.
And kind of one of your subspecialties are diabetics. At Think, there are probably, I assume there are other physicians that you work with and coordinate with that also see diabetes patients.
Yeah, a diabetic obviously needs to work with their primary care doctor in controlling their blood sugars, but they also need to see a podiatrist at least once a year for a comprehensive foot evaluation, just to make sure there's nothing wrong.
So that doesn't happen to you,
Yeah,
right?
so you aren't one of those people, but most of those problems are avoidable. But they also need to see a dentist, and they need to see an optometrist as well.
Well, it's about wellness at Think, and to me that's what really stood out when I first started to learn about this concept, because it is so different than anything we currently have in Omaha. It's really unique. This is their website if you would like to go and sort of wrap your head around this concept and get to know some of the other doctors, of course, Dr. Copple there and part of it. How do patients then make appointments with you? Is it, I mean, just typical, or do they need a referral from their current general physician?
No,
if
they
they're
don't
not
need a
with Think?
referral. If they need to come in to see me, they can simply just call the number there on the screen, go to our website, and you can make an appointment through that as well.
Yeah, they can find you at thinkhealthcare.org as well.
Dr.
Correct.
Copple, thanks for showing us this technology. It's nice to have you
that's
back.
Yeah, thanks for
fascinating.
having me again.
Good to
Thank
see
you.
All right.